WHO has been saying for months that they don't think that transmission from people without symptoms is happening on a widespread level. They don't think it's the major driver of the pandemic. That's what they say. They say most of the transmission is from people who have symptoms. But so many other health organizations like the CDC and European governments have made mask wearing either mandatory or strongly encouraged it, and WHO has not done that. So they finally did that Friday. So it does seem like there's some change in their thinking. Most of the countries with large pandemic or with large outbreaks have already changed their guidance. So it's really unclear. I mean, they say they did it based on new evidence that they commissioned. Although I talked to a scientist this morning who looked at that evidence and said, I really don't see why they changed it based on that, and they're basically just catching up with what everybody else has been saying, so, yeah, it's kind of a mess. It is a totally new virus. I mean, nobody knew this existed until January, so it's been a very steep learning curve, and one of the things WHO is very clear about today was that there are still so many unknowns about this, and, one of the doctors said, "Look, for every question we have 10 others that are unanswered." So there's a lot we don't know about it. I mean, we know that it transmits through respiratory droplets, so like, little bits of, spit that come out of your mouth when you cough or sneeze. But we're still trying to understand the nuance of this, if people can transmit it when they're speaking loudly or if they're singing. So there's some thought that that could be happening, but they don't know what the percentage is between people who spread it when they have symptoms, like when they're actively sick and coughing and sneezing, and people who aren't symptomatic. So we don't know what that balance is.